Hey guys, so I'm trying something new today. I'm gonna try to make a video on my car while I'm driving to work. I had this amazing vision in my mind of how I wanted to make videos at home with perfect lighting and my hair and makeup all done, and of course getting all this done while my daughter was napping, and none of that happened because ain't nobody got time for that when you have a baby. But that's okay because I realized that there's this 25 to 30 minutes that I spend in the car twice a week, and I can totally maximize that and use up that time to provide you guys with some awesome information. So today I'm going to be talking about the thyroid, and this is something that I talk to my patients about every single day because there's a huge issue with how the medical system kind of views and assesses thyroid issues and treats thyroid issues. So in my opinion, it's really, really important to make sure that you're getting the proper assessment and the proper treatment for any thyroid related problem. So what is the thyroid? So the thyroid is a gland that sits on top of your trachea in your neck, and it regulates so many things in the body. It regulates a lot of different organ functions. It regulates your temperature, your digestion, your energy levels, so many different things, so many different functions are carried out by the thyroid. So needless to say, it's very important for your thyroid to be functioning optimally if you want to feel your best. Now, how do you know if you might have thyroid issues? Well, you might be symptomatic, so you might experience things like low energy. That's one of the most common symptoms, and I would say one of the first symptoms that comes up for people whenever their thyroid starts to become a little bit more sluggish. So I would say low energy, fatigue, just kind of feeling really tired no matter what you do, no matter what you eat, no matter how many hours you sleep at night, just kind of feeling really, really fatigued. Another common symptom is constipation. Another one is hair loss or hair thinning, or if you lose the outer third of your eyebrows. That's also kind of a classic symptom of hypothyroidism. And the other one that I see quite a bit in practice is either weight gain or just stubborn weight that doesn't want to come off, and no matter how much you work out or no matter how much you diet, you're just kind of not able to lose those 15 or 20 or however many pounds. And for new moms, actually, this sometimes gets chalked up to baby weight and not being able to lose your baby weight, and that their thyroid just gets completely ignored. But the thyroid can definitely be affected after pregnancy because the demand on the thyroid increases during pregnancy. So it's really important to consider the thyroid as a factor in anytime somebody has trouble losing weight effectively. So if you're experiencing these symptoms, you'll probably go and see your doctor, and what a medical doctor or your family doctor will probably do is run a TSH test, which stands for thyroid stimulating hormone. So it's something that's released by your brain to stimulate your thyroid to release thyroid hormone. So this is kind of the gold standard test in the medical community for thyroid function. If it's low, you have more of a hyperthyroidism picture, and if it's high, you have more of a hypothyroidism picture. I'm only going to be talking about hypothyroidism today and subclinical hypothyroidism. I'm not going to be talking about Graves or hyperthyroidism. That's kind of the flip side of it, and I just want to focus on subclinical hypothyroidism today because it's what I see most commonly in practice. So your doctor will run a TSH. Sometimes, if you're lucky, they'll also run a T4, which is an inactive version of the thyroid hormone. So sometimes the lab allows you to run a T4 if your TSH is outside of the range, outside of the normal range, which is somewhere between 0 and 5 usually. If you're outside of that range, like let's say you're at like a 6, then they'll run a T4 for you. But otherwise, if you're within the normal range, so to speak, they won't run any extra tests because on paper, you're perfectly healthy. But there's more to that, so I'll get to that in a minute. But just kind of letting you know what to expect if you're going to see your family doctor in terms of testing. So they'll run a TSH, maybe T4, maybe like the 1% or very few doctors will actually run an antibody. I think usually also if your TSH is outside of the range, they'll run a thyroid antibody, so the TPO it's called, and so that will tell us whether or not there's an autoimmune factor to your hypothyroidism. So what's the problem with testing? So I have a lot to say about this. So, as you know, I'm a naturopathic doctor, and I do have optimal ranges for certain tests, and as should any other naturopathic doctor. Any ND that you see will have kind of an optimal value for most tests that you do. And the reason for that is because our goal is not to just keep you alive. Our goal is to have you functioning optimally, is to have you feeling your best, is to have our patients have a normal sex drive and lots of energy and feel good and feel happy. So we want to get you to optimal function. We're not just going to look at your labs and say, oh yeah, okay, so you're surviving. It looks like on paper you're doing great, and off you go. Lots of people still have symptoms when they're within the normal range of a TSH, and this is just a fact. But the problem is that medical doctors just aren't, I think that they're just not, if it's like a family doctor, they're just not instructed to treat, like they're not instructed to intervene when your TSH is still within the normal range, but kind of on the higher end of the range. Usually they'll only treat if it's like really outside of the range, which is really sad because people walk around with, suboptimal thyroid function and symptoms and they feel like crap and their doctor can't help them. Now, this is excluding actually reproductive endocrinologists. Reproductive endocrinologists actually tend to have the same optimal range for thyroid function as naturopathic doctors, which is great because they'll intervene a lot sooner. And the reason that reproductive endocrinologists are also very strict in terms of what they like to see on a TSH is because they work with fertility patients and they work with women who are trying to conceive, and they know that the demand on the thyroid increases with pregnancy, and they know that the hypothyroidism is the #1 cause of early miscarriage, and obviously that's not something that we want to happen. So we want the thyroid to be at optimal function, ideally before a woman gets pregnant. So usually the range for reproductive endocrinologists is somewhere, they'll want it to be below a 2.5. For me, the optimal range of a TSH is between a 1 and a 2. So your family doctor might run a TSH for you and it might come back at like a 4, and they'll say that you're completely normal and they'll send you home. And this actually happens a lot. This is really sad, but you go to the doctor and you do your labs and the doctor. So this is something that happens pretty commonly. You see the doctor, you tell them that you're feeling really tired, you have a low mood, you're constipated, you're not able to lose weight, you have no sex drive, you're just feeling really not like yourself, and the doctor will run some tests and your TSH comes back at like a 3.5, and your doctor says you're completely healthy and your thyroid is normal, and he'll prescribe an antidepressant and tell you to come back in like maybe 6 weeks to 2 months to increase your dose. And this happens all the time because the thyroid is not investigated further as the cause. And I bet that if you feel that way and your TSH is at a 3.5 and you get proper treatment for your thyroid, you would feel a lot better. Most or all of your symptoms would resolve. So that's my ideal level of a TSH test. It's between a 1 and a 2. However, the way that a naturopathic doctor tests the thyroid is very different from the way that a medical doctor. So like I said before, a medical doctor is kind of very restricted by the way that the system is set up, because medical doctors really have to justify every single test that they run, and they can't go and use up, the taxpayers' dollars for all these extra tests. But for a naturopathic doctor, it really doesn't matter because the patient's paying out of pocket. So we can run whatever tests we want. So what I usually run, I shouldn't speak for other naturopaths actually, because I have no idea what other people run. But what I run whenever I'm looking at somebody's thyroid is CBC, ferritin, TSH, T3, T4, TPO, reverse T3. So that's 7 different tests looking at the thyroid. 2 of those are more looking at red blood cells and iron levels. And the reason that I put ferritin in there is because that's your level of iron in the blood. And I've seen low iron levels really negatively impact the thyroid, and the reason for that is because iron is one of the nutrients that's required for proper thyroid function. So I've seen when somebody has a low iron level, their TSH will increase, and then if I correct their iron deficiency or their anemia, their TSH will normalize on its own without even touching the thyroid. So I find that it's really important now to just, if I really suspect that someone has thyroid issues and they've got symptoms, I I always test their iron levels as well, especially if it's a woman, because women are chronically, you know, more likely to be iron deficient than men. So I will run those tests. So that's 7 versus the 1 or 2 that a medical doctor would normally run, right? So it's telling me a lot more about your body, because unfortunately TSH is not the complete picture. So that's just a little bit about the different testing that's involved for the thyroid. I'm not going to get into treatment because there are so many different ways to treat the thyroid. You know, from a naturopathic standpoint, there's botanical medicine, there's supplements, there's diet, there's vitamin injections, there's lifestyle things, there's medication. I can prescribe Synthroid, but it really depends on the person. It depends on your presentation, on your symptoms, on your labs, on your history. We take all of that into account. It depends on our therapeutic goals too, right? So it really depends on all of that, and that's how I choose what treatment would be best for each person. So I don't really have like one go-to protocol for hypothyroidism. But what I will say is that the problem with mainstream treatment of hypothyroidism is that it doesn't always help. So the gold standard treatment for hypothyroidism is Synthroid, which is T4 basically, T4 therapy. So T4 is inactive thyroid hormone. So your body produces T4 in larger amounts and it produces T3 in smaller amounts. But T3 is the actual active thyroid hormone. It carries out all the functions of the thyroid onto the actual tissues and the cells. So T3 is what you want to have enough of, right? I mean, you want to have enough T4 as well, because T4 converts to T3, but T4 is inactive is kind of the point I'm trying to make. So T4, it first has to be converted to T3. So I'll just give you this analogy. So let's say that there's a problem with the drain of your bathtub. It's like clogged up with a bunch of dog hair, which happens a lot in my house. And you're filling up the bathtub with water and you're just like keep filling it up and adding more and more water. Like, is that gonna fix that problem with the clogged drain? No, it's not. It doesn't matter how much water you add. Eventually, if you keep adding more water, it's just gonna overflow and cause a big giant mess. And this is what happens when a conversion issue, meaning that somebody has a problem converting T4 to T3, when a conversion issue is treated with Synthroid, because you just keep adding more and more and more T4, and people sometimes people get better if it's not a conversion issue, but sometimes people get sicker. So there's 2 things that can go wrong with the thyroid. You can have a supply issue. You can either not be making enough T4 for whatever reason, or you can have a conversion issue. And the conversion issue is a case where adding more T4 would not be fixing the problem. Now, why would somebody have a conversion issue? So what happens during the conversion? That's a chemical reaction that happens, and there's steps that require certain nutrients that act as cofactors, meaning these nutrients allow the reaction to happen. So what are these nutrients? So they're usually things like magnesium, B6, zinc, iodine, iron. So all these things allow the proper conversion of T4 to T3 to happen on a regular basis. And if you're lacking in these nutrients, then you're not going to be converting your T4 properly. So adding extra T4, aka Synthroid, to that is not going to fix the problem. So this is something that I find that no medical doctor ever looks at unless you're going to an integrative medical doctor who you're paying out of pocket. If you're just going to your family doctor and you tell them about a conversion issue, they're going to look at you like you just hit your head. So anyways, I just wanted to let you guys know and give you a little bit of information about the thyroid. I talk to patients about this every day. The thyroid is so important when it comes to fertility, which is why I talk about this so much, because like I said, before a woman gets pregnant, we want her thyroid to be functioning optimally, because the thyroid demand increases with pregnancy and the thyroid can cause miscarriage if it's not functioning optimally. So I pay extra close attention to the thyroid in my practice, and if you have any of these symptoms, or if you suspect that you might have thyroid issues, if it runs in your family, I would get it checked out as well. And I just wanted to give you a little bit of information, and if you suspect that there's something wrong with your thyroid, I would suggest seeing a naturopathic doctor just so you can get a proper workup and a proper assessment and kind of not fall through the cracks of the medical system. Thank you so much for watching, guys, and I will see you in the next video. Bye!